What happens in Vegas stays in Vegas.
What in the wild, wild worlds of eye doctors is going on here?
But what happens at AAO 2015 is broadcast for the world to see.
Big finish. Ready?
I'm Rachel Kopchak for AAO TV. The 2015 opening session inspired, informed, and of course, entertained. His surprise performance is an annual tradition, and this year, Dr. Jonathan Rubinstein wowed the crowd with a spot-on Elvis impersonation. Eventually joined by his son Danny and one of Vegas's own Elvis impersonators.
Thank you very much. Thank you.
The performance was followed by the recognition of several honored guests and the presentation of the Laureate Recognition Award to Dr. Bruce E. Spivey. Next, best-selling author Edmund Morris shared insight into the biographies he wrote about Presidents Ronald Reagan and Teddy Roosevelt and how their myopia helped shape them into the great men we remember today.
As Julian Street remarked in 1915, Theodore Roosevelt was the most far-sighted, nearsighted man this country has ever produced. Both presidents transcended their mutual disability.
Finally, Dr. Ann Coleman delivered the Jackson Memorial Lecture on using big data to make discoveries about cataract surgery. Coleman stressed that big data is very important to all of ophthalmology because it can be used to improve care.
For example, endophthalmitis, very, very rare condition. And so how do we get enough cases of endophthalmitis to study it? Well, you really need big data. And then you have enough cases that you can start doing some clinical trials to see if they get antibiotics or not. Different ones can help in terms of managing endophthalmitis and preventing it.
From the opening session to right here on the exhibit floor, the opportunities to learn are endless. One place to do that is here, inside the Learning Lounge. There are informal, small group discussions every 15 minutes. Dr. Susan Bressler spoke about the management of neovascular macular degeneration and how to best implement the therapy.
So we explored looking at fixed dosing regimens as well as regimens delivered on an as-needed basis, both of which have the potential to either reduce visits on fixed dosing regimens or reduce injections on as-needed regimens.
This was all done with the intention to decrease the burden of all the visits and injections as well as decrease the cost. Dr. David Greenfield discussed the management of glaucoma at low tension for this year's Robert N. Schaefer Lecture. Dr. Greenfield said normal tension glaucoma is a complex multifactorial disorder that involves both pressure-related and unrelated mechanisms of action. Clinicians need to use practices that prevent further loss of vision when visual field loss continues, despite very low levels of intraocular pressure.
We mentioned a targeted approach whereby we consider compressive visual pathway lesions and other types of neuro-ophthalmologic conditions that often mimic low-tension glaucoma, where we identify the intraocular pressure that is responsible for progression, and that when progression continues to occur, that surgery, in addition to non-surgical approaches, be used in order to achieve additional IOP lowering to prevent visual field progression.
AAO TV will continue right after this message.
Coast to coast, dusk to dawn.
SightPath is on the move.
Mile after mile, all year long.
SightPath is on the move.
Our 200 employees travel 3 million miles a year
to help our customers provide quality care close to home.
All we do is eyes.
All day, every day.
Every day.
Join the movement.
I'm joined now by Dr. Ian Crozier. He is an infectious disease doctor who's been working in West Africa for some time, and you have quite an incredible story about your connection to Ebola. Why don't you tell us the story?
So I'm an infectious diseases specialist. I've been living and working in Uganda for the past 6 years, and in August last year, before this was sort of part of a national conversation, I was seconded by the World Health Organization to Kenema which was in eastern Sierra Leone and really became ground zero for the Sierra Leone outbreak as the virus crossed the border from Guinea. And at the end of the month, I became ill myself. And so I was medevacuated to Emory University Hospital, where I spent the next 6 weeks and had a very severe illness. But eventually, because of the expertise offered to me at that Emory bedside, I survived. I then began this period as an Ebola survivor. Quickly realized that even when it's over, it's not really over. We found that there was high levels of active, multiplying, viable Ebola virus replicating or multiplying in the front room of my eye. I developed severe vision loss. I went blind in the eye in a few weeks, lost the pressure in the eye, and then had a really bizarre color change where my blue iris turned green for a time. And ultimately, to make a very long story short, some part of that vision has returned, in large part. I'm here with my eye team and with John Fankhauser from the ELWA hospital, who's been a hero of this outbreak and has been taking care of many, many Liberian survivors, to really talk about what needs to happen as we move forward.
My perspective, of course, is in Liberia. That's the country I call home. And, you know, we have very few eye care providers for the population. So we're going to need help from the outside. And I think having specialists like the Emory Eye Team and the NIH come over and work alongside the eye care providers in the country and teach them what they need to know to be able to give good care to this group of patients, as well as supplementing what's there with additional resources, is going to be critical for these countries to recover from the epidemic.
Ophthalmologists will continue to have an impact on both the world and their patients. That's why we spoke to a few to find out why they chose the field of ophthalmology.
I chose to be an ophthalmologist because I wanted to become very, very good at something. And when I was a kid, I used to take watches apart and put them back together. And I figured out I could do that with my hands, and it has been one of the best decisions I've ever made in my life.
When I was a child, I loved my ophthalmologist. I had a number of eye problems as a kid and asked him when I was 10 years old, what do I need to do to go into ophthalmology? Never changed my mind. It's the best profession in the world. I'd do it again in a second.
I'm fourth-generation physician, and I love ophthalmology. We help people of all ages, both sexes. We do surgery, we do medicine. You know, it's fantastic.
The American Academy of Ophthalmology is undergoing a rebranding. It's more than just changing the tagline and logo. It's about refocusing and driving the field of ophthalmology forward.
It's really going to change the way you do business. It's going to focus it, and it's going to keep your eye on what the really important value for the members really is, and for the entire profession. We view this not really just as a rebranding of the Academy, but as a rebranding of the entire profession of ophthalmology.
What is the overall outlook for the field of ophthalmology? While it remains one of the most desired specialties to practice in, there's now an even bigger emphasis on quality of patient care as well as cost. The 2015 AAO president-elect remains optimistic and says the Academy is well positioned to serve the needs of the patients, society, and AAO members.
My goal is to actually scale this down and make it understandable to the men and women in a solo practice, group practice, and academe, that it is reasonable if we continue to do the right thing and actually be innovative, push quality, and put patients first. We're still going to do very well.
We'll see you at AAO 2016 in Chicago. I'm Rachel Kopchak. Thank you for watching AAO TV.
I want to look beautiful. I'm as young as I feel.
And I want to look as young as I am.
I want to take control of my body.
I want to feel like I'm setting the tone. I want to see clearer. I want to focus sharper.
I want my coworkers to look over and say, oh my goodness.
You look amazing.
You go, girl.
I want to feel amazing.
Because I am.
I am Alfion.